Well, good morning, friends. Welcome to this town hall, Awareness to Action, Myth Busting, Mental Health. We're so glad to see you all here, and we will open this meeting with the land acknowledgement. The land that Eureka rests on, as my phone goes to the close screen. Hold on. The land that Eureka rests on is known in the Wiyot language as Jerujiji. Past actions by local, state, and federal governments removed the Wiyot and other indigenous peoples from the land and threatened to destroy their cultural practices. The City of Eureka acknowledged the Wiyot community, their elders, both past and present, as well as future generations. This acknowledgement demonstrates the city's commitment to dismantle the ongoing legacies of settler colonialism. And again, I just want to welcome everybody here. We're so glad to see everyone. I want to thank Department of Health and Human Services, Behavioral Health Board, and NAMI for partnering with us to bring this forward to you, and everybody out here that's tabling, so you guys can walk around and check them out and see what they're up to. And I've had some people ask me, Kim, why is this initiative so important? By the way, I'm Kim Burgell. I'm the mayor of Eureka, in case you don't know. And I've had a lot of experiences in my life with family members, and I'm just going to share a brief one. About 10 years ago, I have a cousin he worked at the lumber mills. He was very strong. He grew up in Dinsmore, which if you're from here, you know that's out kind of in the boonies. And so he learned that, men are very stoic and men are very much, pick up themselves by their bootstraps, all of those things. And he ended up moving to the big city, Sacramento. He lived there for a while and worked in a mill out there. And he lost his job. And he lost his job, and then he lost his wife. He was very depressed. She didn't die, but the family started to fall apart. And for him, he was a guy that was an amazing, incredible person. I mean, you guys would have loved him. He was funny. He was just an amazing human. But he couldn't ask for help. He just couldn't do it. So after about a year and a half of kind of going through all of these things and his wife leaving now and the family falling apart, not having a job, not being able to pay his bills, losing his farm, he shot himself. And I'm going to tell you that suicide is so difficult for all of us that remain. And, for a while I had kind of ill will for him. I was really mad at him. And I realized that sometimes it's the best that we can do. And he made a mistake in my mind, but today I can stand here and I can share his experience with you guys. And I can say that it's so, so important for us to address stigma. So important for us to address stigma. So this doesn't have to happen over and over and over again, which it does, because we're taught don't ask for help. So I'm really grateful and thankful, to see you all here. And with that, I'm going to turn it over to our mediator, Jacob Rosen, Managing Mental Health Clinician.
All right, good morning, everyone. Can everyone hear okay? All right. So we'll be going through a couple panels today. The first one will be our professional panel, and we'll pass this over here. So when it's just talking to Mike, and we can pass it down the line. And we have a couple seated questions first, and so we'll go through those, and then we'll open it up to questions from the audience, and then Mayor Burgell will go around with the microphone, and we'll make sure that you're able to speak. And so we'll do that, then we'll have a break. And then we'll have some food. We'll get into another panel, and then we'll get into our speakers today. Joseph Reed, who we're very thankful was able to come out from Michigan, his family, and we're really looking forward to get to hear him speak. So without further ado, we'll jump into the first question. Can you give a brief description, let's go down the line and do a brief introduction and kind of description of the work that you do and how it interfaces with mental health.
Okay, wonderful. So I'm Stacy Eads. I'm the District Attorney of Humboldt County. And thank you so much for having me here this morning. It's truly an honor, and I'm really excited to learn as much as I can. So I feel, frankly, a little silly being up here on the panel. But certainly, my world is impacted on a daily basis by mental health, and I think that's true of everyone. It's just part of being a human. So I began my work in the District Attorney's Office in 2001. I returned to Humboldt County after being, raised here, and my family was still here, and my close friends were still here, and I have a deep love for Humboldt County and the people that live here. So I'm so honored every day to be able to serve Humboldt County's residents and do what I can to help make this be the safest place to live. And an important part of that, of course, is trying to do what I can every day to help address the mental health challenges that some of our community members face. And, just as the mayor spoke about, I too, of course, have been impacted by folks with mental health struggles and have had some pretty significant impacts in my personal life. But I've also had the opportunity to see folks work through mental health challenges via the criminal justice system. And I think oftentimes folks will initially think about the criminal justice system in connection with defendants, but the criminal justice system really impacts us all. So it's also in the realm of folks that are victimized by crime. And so I know we'll address a little bit more of these later, these issues. But again, I'm honored to be here. I've been serving for I'm in my 23rd, 24th year working in the district attorney's office. And again, it's truly an honor. I just really quickly, I spent the first half of my career working in the juvenile justice system. So I really saw, kind of got a little bit of a inside glimpse of some of the struggles that our youth face in their daily lives and families, and the challenges, and really the attempts within our community to provide wraparound services to help kids and help address the ACEs challenge that really is a significant factor for Humboldt County. After that, I kind of transitioned into working primarily with the sexual assault and child abuse services team. So a lot of those cases were, certainly impacted by folks that were struggling with significant mental health challenges. So thank you again. It's an honor to be here. And I'm an attorney. I talk a lot. I'll stop.
Hi, good morning. My name's Emmy Botzler-Rogers. I'm the Behavioral Health Director for Humboldt County, and it's also quite an honor to be here. I got to be here last year and appreciated it so much and glad to be back. I have been in my position with County Behavioral Health, this position as the Director, since 2017. Prior to that, I was the Children's Behavioral Health Deputy Director. Just historically, I was licensed back in 1995. I started by working with little kids. I have a lot of passion for that. So my whole life has been committed to working within the field of mental health. I started with little kids, did that work for a number of years, worked with infants, toddlers, elementary age, all the way up through high school and adults, and then ended up kind of just expanding my practice to include the whole spectrum, moved into administrative work, and then eventually landed where I am now. I also grew up in Humboldt County. I left after I graduated college. I left for about 15 years, and I came back in 2007, and just am deeply, deeply committed to the community and to the health and well-being of everyone here. I'm also deeply committed, and I know we'll get to talk more about this later, to ending stigma. I just feel like it's such a profoundly impactful challenge for us here locally, across the state, across the country. So I really see part of my role, part of my job as being an advocate, both locally and at the state level, for people with mental illness and for our community. So thank you very much.
Hi, my name is Jamaica Bartz. I am the current Chief of Operations over at Waterfront Recovery Services and the incoming Executive Director. I've been working for the agency since 2016, when we started out as a social model and opened up a medical model in 2017. When we opened up the medical model, we started to work with focusing on co-occurring, so substance use disorder with co-occurring mental health disorders, and treating both of them together to, get some better results and stabilize some folks. I was born and raised here in Humboldt County. I am one of the many and few that have overcome their own addiction and have a great passion for working in this community and helping be part of the solution and really understanding why and how some individuals become addicted. And a lot of it does start through mental health disorders and traumatic experiences. And so I'm incredibly dedicated to helping an individual stabilize and become what they are meant to become and succeed in life. Thank you.
Good morning. I'm Kelly Johnson. I'm a licensed, clinical social worker, and I've been a social worker for over 20 years, primarily working in community mental health, and the last 15 plus years have been primarily in crisis services. I currently work for the Yurok Tribal Police as a crisis intervention team coordinator, which is a model that's used to bring behavioral health, law enforcement, and community advocates and other service providers together to improve the crisis response system of care. I serve all of Humboldt County and Del Norte counties, all the law enforcement agencies, behavioral health providers, et cetera. And so we lead trainings, that 40-hour trainings that teach how to recognize signs and symptoms of behavioral health disorders and effective interventions to de-escalate people who are in crisis and to connect all the different first responders and crisis workers so that they know the resources that exist in the community, ideally to divert people from the criminal justice system when they're experiencing behavioral health crises. I also am a person with lived experience, and I'm a family member of people with both mental health and substance use disorders. So this is very close to home. And I very much care about doing this work in a way that's trauma informed and really bringing people together and reducing the stigma around us versus them in regards to law enforcement, behavioral health providers. We're all kind of in this work together. And I'm all about systems change and improving the crisis response system of care for our whole community. Thank you.
Thank you, everyone, for being here today. We super appreciate it. And thank you to the audience for being here today as well. We'll get into our first question. Today, we're talking about stigma and myth busting. Why does fighting stigma play an important role in your work specifically?
I think that in terms of prosecution and addressing criminal activity and conduct within the community, I think that there are, unfortunately, sometimes occasions that folks jump to conclusions all too quickly regarding behaviors and make assumptions. I think it's really important to recognize in terms of those folks that do find themselves entangled in the criminal justice system, in particular, as in terms of folks that have potentially committed offenses, that there are many people within our community that I think it's on now. It just keeps going. Here.
Try this one.
Okay, here we go. I think one important thing, I don't know what I'm, but I could tell. Anyhow, it's fine. As long as you can hear me, that's what really counts, right? I don't know if I move it. It just keeps going up. Okay. Okay. All right. So it's just me. It's me. As long as I don't wave it around. Okay. Okay. All right. So here's the big point, the big takeaway I want. Just because somebody has a mental health illness, a mental health disorder, does not mean they are a criminal. Period. It's that simple. Sorry. So in terms of the criminal justice system, I think that's a big takeaway. The other bit is that I constantly feel like I need to remind folks that others that get involved within the criminal justice system are those who are victimized. And as the prosecution team, as within the district attorney's office, we are regularly working with folks who are victims of crime, who suffer from mental health illness as well. And so it's always really important as well to remember that sometimes our community's most vulnerable individuals are those who are somewhat preyed upon and taken advantage of. And so that's an important piece too. So if you have the opportunity to serve as a juror, go in, as we always ask you, with an open mind, listen to the facts as they're presented, and give everyone a little bit of mercy. So thank you.
Okay, so why does fighting stigma play an important role in my work? I would say it is just core to the work that I do. It's the work that I do every day. I feel tremendous responsibility to work towards ending stigma. I feel that because stigma to all of us can be seen as so alive and well everywhere, right? We see that all the time, that stigma is active in our lives, in our community, like I said, across the state, across the country. And I also recognize that stigma has devastating impacts, right? So sure, it makes us feel uncomfortable, those, people struggling with mental illness. It makes us feel uncomfortable, but it also has greater impacts, farther reaching impacts than that. It deters people from seeking treatment, which can lead to incredibly dangerous outcomes, certainly ongoing continued suffering, but it also can lead to death. So not addressing stigma leaves our community, our family, ourselves incredibly vulnerable to, as I said, continued suffering and pretty adverse outcomes. So in my role as County Behavioral Health Director, I hold a very tremendous burden and responsibility around continuing to advocate for ending stigma. And I say ending stigma because I think that sometimes we can get in positions where we're saying, let's reduce stigma, let's address stigma, but really for the health and well-being of our community, ending stigma is critical. Thank you.
So fighting stigma plays a very important role in my line of work because not only are we dealing with substance use disorder individuals, but coupled with mental health disorders, our clientele, they're already broken, feeling less than, being judged all the time. And, you put the two together and you get people who are really, in a lot of darkness. And it's important to recognize that for not just the community, but for the population that we're serving, that change can happen. Treatment is necessary. Treatment can help change and help lift people up from the place that they're coming from. It's like the clients get a double whammy. So now not only are you, addicted to a substance, but you have a mental health disorder. And like Emmy was saying, people don't want to get treated. It hinders the treatment and being judged. And you get both of those together. And now they're just not just suffering from mental health, they're suffering from addiction and don't feel like not only are they not worth it, but, you know, what are people going to think of me? Because addiction and mental health doesn't just happen to people who are homeless or on the streets or, you know, in poverty. It happens to people, you know, your average community member, and they start thinking, well, what are people going to think of me, you know, if I enter treatment or if I seek help? And I really, you know, would like for the community and the world in general to see people as, you know, it's okay to be broken, and it's okay to seek help, and it doesn't make you less than, and it doesn't make you a bad person. Thank you.
So, specifically in my role doing collaborative work with law enforcement and behavioral health, I've seen stigma not just towards the people that we serve, but also towards each other. And so, a big part of the work that I do through the crisis intervention team, CIT trainings, is really to break down those walls to help people understand better the roles of behavioral health providers and the roles of law enforcement in terms of dealing with folks who are experiencing crises, and to really break down that us versus them, as well as learning how to be trauma informed and treat people with dignity and respect when you're having interactions with them. And I will just share from my own personal lived experience, I've experienced stigma myself, and I'm really these last 2.5 years becoming more, as Leah said, I'm coming out about my own mental health struggles, because I had a really dark period of time where I had a very bad depressive episode and had to go out of leave from work for 5 months. And it led to the point where a law enforcement officer came to do a welfare check on me at my home. And it was somebody that I had trained, and they did not treat me very well. And it was really humbling. I didn't want my coworkers or people in the community to know what was going on with me. So I'm really, you know, even though I've been doing this work for a long time, I think the stigma piece is huge. Like, I was hiding in my house for 5 months because I was scared for people to know what was going on. And so personally and professionally, it's super important. So thank you all for being here today and supporting us with this work.
Kind of on that note, the next question is, what is the number one mental health myth you would like to bust today? And I know some of that has been alluded to, but if we can elaborate on that.
I think that I kind of already jumped the gun a bit in terms of the criminal justice system, and that is that folks with mental illness are clearly not, you know, criminal. There are folks that find themselves within the criminal justice system who certainly are struggling with mental illness. That absolutely does happen. I think that, you know, just looking at terms of what we see in Humboldt County, we now do have a lot of different diversion programs that historically haven't existed within the criminal justice system, and this is actually throughout the state of California. And one of the types of diversion programs, and diversion is just to divert an individual away from the criminal justice system. So if they may have committed an offense that was criminal in nature, and a criminal complaint has been filed charging them with crimes, that that perhaps their case can be diverted away from criminal justice system so they do not suffer a conviction as a result of the criminal conduct if certain circumstances are present. And so one of those types of diversion that we now have within our justice system is the mental health diversion. And what the mental health diversion is statutory, and what it really contemplates is, you know, was the individual suffering from a mental health disorder, and if so, did that disorder play a significant role in the commission of the crime? And so there can be evaluations done by mental health professionals that help guide us within the criminal justice system, because as previously stated, I'm an attorney. I'm not a mental health professional, so certainly not qualified to make those assessments, not even close. And so we'll take that information from mental health professionals. Sometimes we challenge it. We have to be careful, in particular, from the perspective of the prosecution of potential malingering or folks, trying to get out of being accountable for their behaviors. And so there can be hearings and discussions regarding, what the appropriate course is. And also we're always, very mindful. It's my job to protect the community and public safety. That's number one. So, we do have hearings, and oftentimes those hearings are at the request of the district attorney's office. But the process, though, does contemplate that individuals that, if the mental health illness was that significant factor, contributing factor in the commission of the crime, and the courts look at all these other factors as well, then it may be most appropriate to have them diverted away from the criminal justice system into behavioral health services, and hopefully some sort of treatment plan can be put in place, some level of supervision and guidance to help, ensure that that plan is effective and that there's compliance on the part of the individual. And ideally, steer them away from the criminal justice system. It could result in a dismissal of the charges, and frankly, that's to the benefit of everyone within the community, because hopefully we'll have a healthier individual who's stabilized and is no longer going to engage into those risky behaviors, and we've gotten them hooked up with services. So that's really the goal, and that's a much greater accomplishment than we can achieve with many convictions and sentences that are primarily punitive in nature. Those can be highly appropriate as well, and sometimes we have people that are engaging in such dangerous behavior that we may need them to not be on our streets. So there's a lot of factors involved. But so in looking at the cases that we handle, we had in 2024 about close to 6,000 referrals, law enforcement referrals, cases where someone is alleged to have, potentially violated the law within the community, and those police reports come our way, and we assess whether charges should be filed or not. And there are a lot of things taken into consideration reaching those determinations. And we ended up with about 3,000 criminal cases being filed in 2024 from that. And then what we saw in 2024 in terms of mental health petitions, so people that are most likely suffering from some mental health disorder, and here are some different noises, sorry about that. And so some folks that are suffering from mental health disorder, possibly a factor in commission of their crime. And we saw about almost 200 petitions. So that's maybe a tenth of the active cases within the criminal court system. So, and not all of those are ultimately granted, but that's a significant portion, but it's hardly everyone, right? And I think we all do know that also within our community, we all have people that we know that are working, handling and addressing a mental health disorder who do not engage in criminal behavior. So I think that's just an important piece.
So the mental health myth that I would like to bust today is that people with mental illness are violent. I just have a few kind of talking points around that. I'm just going to read through my list. This was just easily found through a search prior to today. So acts of violence by those with mental illness are relatively uncommon. Only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. People with serious mental illnesses are over 10 times more likely to be victims of a violent crime than the general population. A large body of data suggests people with mental illness are more likely to be a victim of a crime than the perpetrator. Certain psychiatric conditions do increase a person's risk of committing a crime. Research suggests that patients with mental illness may be more prone to violence if they do not receive adequate treatment. if they are actively experiencing delusions or have longstanding paranoia. And such patients are often under the influence of their psychiatric illness, such as command hallucinations. Comorbidities also play a role, and they include conditions such as substance use disorders, unemployment, homelessness, and secondary effects of mental illness, such as cognitive impairment, which compound the risk of committing a violent crime. This second part, I think, takes us back to what we were talking about at the beginning, which is stigma and the importance of seeking treatment so that you can offset the risks that come with these other things.
So the myth that I want to bust is, and I don't want to sound contradicting at all, because while doing the line of work that I do, working with substance use disorder and co-occurring mental health disorders, many times and oftentimes they go hand in hand. However, not all persons with mental health disorders have a substance use disorders. I think that many times it seems that way based on behaviors or persons with mental health disorders being willing to dabble, they might want to dabble in a substance, but it's not necessarily their main disorder. Over at Waterfront, we've brought in people, stabilized them, got them off substances, but they will still, their glaring problem is the mental health disorder. I think community members historically can be incredibly insensitive. They'll see people walking down the street and they'll have a mental health disorder and they might be acting out of sorts. And the immediate comment or judgment that comes with that is that, oh, look at this drug addict. They're on drugs. They're acting all crazy. But it's a lot of times not even that. It is the mental health. And so while persons with mental health disorders often have a co-occurring of substance use, it does not mean that is always the case. I also wanted to myth bust that persons with mental health disorders, it doesn't mean that they are not intelligent, that they don't, their thoughts can be disorganized and they're not stabilized and they have things hindering their daily ability to have a regular, normal life. But it doesn't mean that they're not intelligent. It does not mean that, once they can get stabilized and get medicated correctly, that they come back to, if that makes sense.
I want to bust all the myths, but I'll choose one. So behavioral health disorders only affect certain specific people, cultures, and classes. That's obviously not true. And so in speaking about my lived experience, I just, I'm a fairly high functioning person most of the time. And I'm really good at hiding when I'm not doing well. And I think we as a community can do better in terms of recognizing when our colleagues are struggling and supporting them. And due to the work that I do with behavioral health and law enforcement, that applies to law enforcement too. And so behavioral health providers and law enforcement are doing really incredibly traumatic work on a daily basis. And we're kind of just expected to move from one crisis to the next without processing or handling our own feelings. And I did that for too long and burnt myself out. And I think if I had done better, sure, self-care is important, but also people that were working with me maybe did better to support me, I may have been able to get better sooner. So I guess I just wanted to highlight mental health disorders, behavioral health disorders can impact all of us, and it's not always obvious.
Thank you. Next question, how can we, both professionals and community members, everyone here today, get better at ending stigma in our day-to-day lives?
I think that with many things, that the key to that is just communicating and not being afraid and not letting fear stop us and doing what's right. And what's right is really to treat each other with compassion and respect. So that's my simple answer to that big question.
I've had a few things just running through my mind as I'm listening to people talk, and I really was appreciating some of the linkage between mental illness and substance use disorders, and how, to my mind, people who are using substances are taking care of themselves the best they can, right? Either through self-medicating or because they've experienced trauma that they're trying to cope with. And so I just want to flag that. I do think that all of us can address stigma through changing how we think about mental illness. And I often think about the kind of the parallel between physical illness and mental illness. All of us were human beings and we experience both those things, right? But if you think about physical illness, if somebody has a cold or twists their ankle or has some sort of kind of low-level symptoms, they get support and they do home self-care and whatever they need to do to kind of feel better from that. And if they have a more serious physical illness, then they seek treatment. They go to the doctor, they get medication, whatever is required to kind of meet that level of physical illness. And if it's a more severe physical illness, then they do what's required. They go to the hospital, they get stabilized, they get long-term treatment, they get on medication, they do the things that's required to help their physical illness. From a cold to cancer, physical illness gets treated. Mental illness is the same. If you're having low-level mental illness, maybe you're having a stressful day, maybe you're having some anxiety, and at that level, you can talk to a friend or get support. You can go to a counselor. As things escalate, maybe you seek more higher levels of treatment. You might end up going to a hospital. You might end up getting medication because you're having depression, right? Or maybe you're having really severe mental illness and you need to end up going to a hospital to get stabilized, to get long-term treatment. It is the same. Physical illness and mental illness both have similar trajectories if you look at those. Yet for some reason in our society, it's okay to talk about the physical illness, but it's not okay to talk about the mental illness. So I guess, again, I'm just compelling us, and I'm clearly speaking to the choir here, changing how we think about mental illness, changing how we treat people with mental illness, changing how we recognize that people who are suffering aren't suffering because they've done something wrong. They're suffering because what's happened to them. And so that shift in thinking, in my opinion, is the way that we collectively address stigma.
Yeah, similar to what Emmy said, for the community, if they can educate, just educate yourself, research a little bit. If you seen, say, an article or post about a community member that had like cancer and, maybe it was a piece in the paper, or maybe they're reaching out to try to get funds to help a family get through something difficult. I know for me personally, I might research that and say, oh gosh, what is that ailment that they have? I want to learn more about that. I don't know if people are necessarily, I feel that people aren't necessarily trying to educate themselves and kind of research like what mental health is all about, or if they see someone acting, in a strange manner, like more judging them than really trying to understand where that person's coming from. As a community, we're never going to be in charge of how someone perceives another individual, but I feel that the more people that educate themselves and really try to understand the suffering individual, that it can open your mind. You can be more open-minded and see through a different lens than just only what you think. We have to know more about something. I feel to know more about it is to have a clear idea and thought on that, and having thoughts about something rather than having a judgment about something. The leap from a judgment to having a thought or idea about something is more profound than I think many of us realize.
I think, excuse me, just talking about it. So, as I'm demonstrating today, I'm sharing some of my lived experience, and it's really uncomfortable, but I think it's important because it's, people need to recognize that, this can impact anybody. And I think as community members in general, when you see something, say something. So if somebody says a derogatory term or is treating somebody with disrespect or making jokes or, politely educate them. And I've learned from my days of being kind of confrontational, radical activist that being in your face adversarial doesn't work very well. And so I've learned to kind of soften my tone, and people will listen to me more if they trust me and have a relationship with me. And so in the work that I do with law enforcement in particular, like, it's taken me a while to learn how to speak in a way that I can be heard. But that's all part of fighting stigma, is finding those bridges and communicating with people.
Thank you. So we'll transition into questions from the audience. So go ahead and raise your hand. There are a few seats for folks who are standing. If you do want to come sit, there are a couple seats up front here and a couple in the middle. If you have a seat next to you, do you mind just raising your hand so that folks can come sit? So anyone who's in the back there, if you want to come and find a seat, we have some. Oh, we're good. Okay, getting a thumbs up. So if you, now we'll shift. If you have a question that you'd like to ask the panel and would like to raise your hand, Mayor Burgell will come around with a microphone and you'll be able to ask a question.
Good afternoon. I have two questions I like to pose, and one is about workers, and the second is about children. So in regard to workers and worker rights, I think it was Ms. Johnson mentioned taking a leave. And I feel like one of the maybe less known rights that workers have is the right to take medical leave. And most people associate medical leave with non-mental health conditions. But depression, anxiety, mental health conditions can be a disability that gives workers the right to take leave. And in California, our state goes further than the federal law. The California Family Rights Act, known as CFRA, gives workers more rights for leave and income replacement. So not only can you take leave and have your job protected for you, but you can, for certain workers, be paid your part of your salary while on leave. How are we doing as a county and a community of getting the word out and doing outreach to workers, particularly working class, about leave rights?
I'll just speak to my experience in that my employer at the time, the HR person, was very helpful. It was never disclosed why I was on leave. I was on medical leave. And my provider was very supportive with the process. I earned state disability income while I was on leave. And so I feel that at least the human resources department at the employer I was at the time was really supportive and helpful. But to the second part about how are we educating the community, you're right. I think we could probably do better. And maybe that's something, I sit on the Humboldt County Behavioral Health Board and also the NAMI Humboldt Board. And so I'm still involved in some community advocacy. So maybe that's something we can work towards improving education about in the community.
Thank you. Great. So some of the panelists have a background in juvenile justice and working with children. And I'm interested to hear a little bit more about special education and how in either the juvenile justice system or with behavioral health, to what extent do your teams interact with special education, particularly from the standpoint where, again, special education criteria, mental health conditions are a few specifically outlined in the law that give children the right to special services. and oftentimes behavior in school, which leads to discipline, which leads to involvement in the criminal justice system, can be attributed to mental health needs. So, can you speak to what extent that's involved in your work?
I can say for County Behavioral Health that we have a very close partnership with our education partners, and we do work collaboratively around supporting children. So, you know, Office of Education, the education system has their own requirements, and we in behavioral health have our own requirements and mandates. But we have built relationship over the years, and Children's Behavioral Health, which is part of our system, has worked very closely with Office of Education. As I said, we've done a number of grants. We've co-located our staff with their staff. And we just work together to kind of cross-educate and make sure we understand one another's systems and requirements so that we can provide kind of the best continuity of care for students who are needing behavioral health services. I'm going to pass it to Stacy about the juvenile justice.
Thank you. I think that's a really great question, and you've got me going through my mind in terms of some instances, and certainly when I think back to my days as the prosecutor in the room for juvenile delinquency matters, frequently the children that were before the court did have behavioral issues within the school. Many of those kids had IEPs or they needed IEPs, and coming to my mind were some really heroic efforts on the part of, frankly, their defense attorneys, oftentimes, in helping to advocate for the kids, not just in the courtroom, but also in the school system, and trying to have those meetings so that the children that needed the IEPs would get the IEPs and get the assistance that they needed to, help have the individualized needs addressed. I also, coming to my mind are instances of children that were victimized and oftentimes victimized by other kids. And so bullying is certainly, kind of, just a sort of, I guess in a layman's term, where some kids with special needs within the school system, I know of relatively recent cases where children were more vulnerable because of some of the challenges as they faced, and so certainly education and community awareness, in my mind, could be helpful, to address some of those behaviors, because I think sometimes kids, are basically acting the way that the adults in their lives have modeled for them, and sometimes that's pretty bad modeling. So I think that's, another, way that we've seen it. In the juvenile justice systems, full of really good intentions, and in terms of, trying to rehabilitate and address the behavior that's brought the child before the court system, and ideally provide them and with any available services. So there's, rehabilitation really is the goal there for the perpetrators. There's less services through that system in terms of the juvenile delinquency system for victims of those crimes. So, the district attorney's victim witness program certainly tries to help provide those support services, and ideally help connect a child that's been victimized with whatever available services. And that's the other big challenge that we certainly face here in Humboldt County, is the lack of adequate services for folks that are struggling. So that's a tremendous issue, and it's a sad thing to provide a victim a list of potential resources, and refer them to potential mental health providers that simply don't have the capacity to take someone else onto their caseload. There's just not enough room. There's long wait lists. So that's a big challenge that I think we could do much better at in terms of having more professionals within our community that can provide on-point services. And I also had, I could go on, so which I won't, but it's a big issue with a lot of good people trying to do their best, but not enough resources.
Right. Thank you for the questions and the answers. Anyone else have questions from the audience? Microphone's coming around.
Hopefully I won't hit the button and screw it up. So this question's for Emmy, and I don't want to put you on the spot, but yesterday on NPR, our fearless leader, won't name anyone, has cut $1 billion to schools for mental health clinicians being placed in schools. And they interviewed a county in Oregon, a rural county that had hired 5 mental health clinicians for schools, and they were going to lose those positions. How much of our school mental health workers do you think might be impacted by this decision?
I feel really on the spot.
So sorry.
Just kidding. I mean, it's such a good flag, and we're all just like waiting and watching. I was talking with Wes about this at the very beginning, that so many things are happening, and we're still trying to just evaluate the impacts of that. In terms of clinicians in the school, the staff that we currently have are not funded through grants at this time or federal funding. However, I can't speak for the schools and because they also have staff that they have providing services. So, and that's not to say things are changing every single day, as you're pointing out. And so we will just continue to wait and watch, and then pivot as best we can to continue to provide the services that are needed. And I've said this repeatedly, but we are really looking to the community and our partners to help us strategize around it, because it's hard for any of us to do this alone with all that's kind of coming down. Thanks for the question.
Hi, whoops, sorry, dropped things. 5 years ago, it was practice, evidently, I guess, for the CIT teams to wait 7 days before coming out to a crisis. And I was just wondering if that has changed up in the last 5 years. My family didn't have 7 days, and I still won't ever understand why words like agencies understand the urgency of your family's crisis. So in 7 days, we'll send somebody else out. I was just wondering if policy had changed and if crisis intervention teams come straight out when there is a crisis. Thanks.
I don't work for DHHS Behavioral Health at this time. Okay, so CIT is a training and a collaboration between agencies, and so every agency operates differently. I know, Jacob has the Crisis Alternative Response of Eureka team. They have different policies. I know County Behavioral Health has the MIST team that is doing some mobile crisis work as well as the mobile response team. And so I can't speak to those policy changes because I don't work for those departments. But CIT itself is a collaboration of stakeholders that meet monthly to talk about how we can collaborate better and then host the trainings.
I might be able to speak to some of that as well. So with mobile crisis teams, there's a lot that's been changing just in the last year with some of the state level policy requirements. And part of that has been a lot of streamlining of policies in terms of response and response timelines. I won't speak for the MIS team with the county, but I can speak for Crisis Alternative Response with Eureka, which I'm the managing clinician for. And our policy is that we need to be on site within an hour of receiving that referral. Our average response time is 15 minutes here in the city for our team to get the referral and then respond out to that site. I don't know the specific situation, obviously, of what your experience was or how long ago that was. So it may be hard for me to gauge like what changed from that point to now. What I can say is that those things are getting better, and we've been collaborating a lot with County Behavioral Health to integrate our kind of resources so that we can provide the best and most responsive services that we can. Emmy, I don't know if you want to add anything to that.
I don't think anything additional except that similar to what Jacob is saying, we through Mobile Crisis Benefit, which is our current benefit that's being lifted up, previously missed or mistransitioning to, and through Mobile Response Team, our responses are meant to be, immediate. And I don't know the time frame in policy, but it's not a response that we would wait 7 days to respond to. So
I'd be happy to connect with you during a break if you have more questions with that. I believe that the state requirements are for urban areas, which would be like the City of Eureka, is 1 hour. For rural, say like Hoopa or Whitethorn, it's a 2-hour time frame. Just because especially if you're calling someone in, say from Garberville, and they need to get up to Hoopa, I mean, it may be that long just for drive time. And so there are some requirements, but certainly, I mean, nothing beyond even 24 hours. I mean, that would be considered being outside of the policy range for the response times dictated by the state. So I'd be happy to connect with you during a break, though, if there are more specific details that you'd like to share. Thank you for the question. Other questions, folks? Hands? No.
I understand that some fairly recent legislation in the state of California has been passed with the goal of increasing, to put it one way, just making it easier for people to get treatment or to be compelled to get treatment. Couple of different laws, and I'm just blanking on what they are, but I believe the county, you folks, Emmy, are working on implementing a new program, right? Can you say, being as how the Treatment Advocacy Center, which is a national organization, their big thing is treatment works, and treatment is what we need more of to reduce stigma. Which is it's a little convoluted, but the better treatment, the more treatment, obviously people will be feeling better and won't be having these kind of maybe disruptive moments when people start thinking that everybody, is suffering from mental illness. Anyway, my point is, I was just curious about the new programs from the state, and what they are, and will they be able to bring more people into treatment so that those people will have a happier life, and so will their families. I'm from NAMI, so we're the family folks here, some of us.
yeah, thank you for the question. I think the two examples that you're referencing are AOT, assisted outpatient treatment, and then care court. Those are the two that are kind of compelling people into treatment. AOT we actually implemented and then ended for board direction and other requirements. Care court is currently what we're implementing and moving forward, and it's very new, so we'll see what the outcomes of that are and the impact. I think you're raising kind of an interesting or an important comment or question that is compelling treatment, is requiring treatment for people the best pathway. And I think there are probably varied perspectives on that. Some people think absolutely, yes, people should be compelled into treatment because they need it and that's how they're going to get better. And there are other groups and advocacy around, no, people should actually choose for themselves if they want treatment. And there's maybe some question about the outcome if somebody's forced into treatment versus choosing themselves. And I'm not landing on either side. I'm just recognizing that there's varied perspectives. And yes, we are currently rolling out care court, and we have individuals referred and making their way through the system, and we will continue to learn about the efficacy and outcomes of that program.
All right.
Hello. As we're nearing the finalizing of budgets at the state and local level, what are some opportunities and threats that you're facing in your job in the next fiscal year?
If anyone's able to disclose, I know that can be kind of a tricky thing if budgets aren't finalized yet. Sometimes it can be difficult to disclose.
Well, I mean, I can just say again, I said already, we're really waiting and watching to see what kind of changes we need to respond to. We, County Behavioral Health and DHHS is working really hard right now to leverage all funding available and to really make sure that we can find all revenue sources possible to ensure that our services continue. We're also looking at all the places we can possibly reduce costs so that we can work as effectively and efficiently as we can, and partnering with others, like I said earlier, to see if there's ways that we can kind of work together to provide services and share funding in ways that really serve our community.